Welcome to this special companion episode where we dive into the nuances of gender and sexual identity affirmative approaches to therapy. I'm excited to share insights from Therapy Training's comprehensive course, which is designed specifically for mental health professionals, counselors, and therapists. If you're tuning in today, you're in for a treat as we unravel some vital concepts that can enhance your therapeutic practice and deepen your understanding of gender and sexual identity. So, what can you expect from today's episode? We'll explore key elements of affirmative therapy, discuss common misconceptions, and highlight practical strategies that you can incorporate into your practice. More importantly, we'll examine how these approaches empower clients and foster a safe space for their authentic selves. Let's get started. First, let's talk about what affirmative therapy really means. Affirmative therapy is a therapeutic approach that recognizes and validates a person's gender identity and sexual orientation, providing a supportive environment for exploration and growth. It's rooted in the understanding that each individual is the expert of their own experience. This approach not only affirms clients' identities, but also actively works to dismantle the societal stigma and discrimination they may face. In the course offered by Therapy Trainings, we learn that affirmative therapy is not a one-size-fits-all model. It's highly individualized. It acknowledges the diversity of experiences within gender and sexual identities. For instance, consider a client who identifies as non-binary. An affirmative therapist will engage in conversations that allow the client to express their unique identity without imposing traditional gender norms or expectations on them. This creates a space where they feel seen, heard, and valued. Now, let's transition to a crucial aspect of affirmative therapy, the importance of language. Words hold power, and the language we use can either affirm or invalidate a person's identity. As therapists, it's essential to be aware of the terminology that resonates with our clients. In the course, we discuss the significance of using correct pronouns and names. Using a client's correct pronouns is not just a matter of respect. It's a fundamental aspect of affirming their identity. It shows that you recognize their agency and autonomy, which is vital in building trust in the therapeutic relationship. You might be wondering, how can I ensure that I'm using the right language? A great way to start is by asking your clients about their preferred pronouns right from the first session. You can say something like, "I want to make sure I address you correctly. What pronouns do you use?" This simple question sets the tone for an open and inclusive space. And remember, if you slip up, it's okay. Acknowledge the mistake, apologize sincerely, and move on. Your willingness to learn and adapt is a powerful message to your clients. Another critical point we explore in Therapy Training's course is the intersectionality of identity. Gender and sexual identity do not exist in a vacuum. They intersect with various aspects of a person's life, including race, socioeconomic status, ability, and more. Understanding intersectionality allows therapists to appreciate the complexities of their clients' experiences and the unique challenges they may face. For example, a queer person of color may encounter different societal barriers and prejudices than a white, cisgender gay man. By acknowledging these intersecting identities, therapists can better tailor their approaches to meet the needs of each client. Now, let's address some common misconceptions surrounding gender and sexual identity affirmative approaches. One prevalent myth is that affirmative therapy is solely about supporting LGBTQ+ clients. While it's true that this approach is particularly relevant for sexual and gender minorities, it's also applicable to anyone exploring their identity. Affirmative therapy encourages self-discovery, validation, and acceptance for all clients, regardless of their background or orientation. Another misconception is that adopting an affirmative approach means compromising therapeutic neutrality. Some may fear that being affirming could sway their professional objectivity. However, the truth is that affirmative therapy doesn't dilute your professionalism. Rather, it enhances it. By recognizing and validating your clients' identities, you're creating a more authentic therapeutic alliance, which is essential for effective therapy. It's about meeting your clients where they are and supporting them in their journey. As we continue, let's delve into some practical strategies you can implement in your practice. One effective approach is incorporating affirmative therapeutic techniques such as narrative therapy. This technique allows clients to share their stories and experiences, providing them with the opportunity to reframe their narratives in a way that affirms their identities. By helping clients explore their personal histories, you're enabling them to challenge societal narratives that may have caused them harm. In addition, consider integrating psychoeducation into your sessions. Educate your clients about the spectrum of gender and sexual identities, as well as the societal challenges they may face. Providing this information can empower clients to better understand themselves and advocate for their needs. For instance, you can share resources such as articles or community organizations that focus on affirming practices and support systems. And let's not forget the power of community. Encouraging clients to connect with affirming communities can make a significant difference in their mental health and overall well-being. Whether it's support groups, online forums, or local organizations, these communities provide a sense of belonging and validation that can be incredibly healing. As a therapist, you can facilitate these connections by sharing information about local resources and encouraging clients to engage with supportive networks. Now, let's shift gears and reflect on some thought-provoking insights related to gender and sexual identity affirmation. It's essential to recognize that our understanding of identity is continuously evolving. As society progresses, so too does the language and frameworks surrounding gender and sexual identity. This means that as mental health professionals, we must remain open and adaptable. Embrace the idea that learning is a lifelong journey. Stay informed about the latest research, attend workshops, and participate in discussions that challenge your perspectives. Moreover, think about the role of privilege in our work. As therapists, we must examine our own identities and the privileges we may hold. Understanding how your own background influences your perspective can lead to more empathetic and effective therapy. This self-reflection is crucial in ensuring that you create a truly inclusive and affirming therapeutic environment. As we wrap up this episode, I encourage you to reflect on how you can incorporate affirmative approaches into your practice. Consider the insights we've discussed today: language, intersectionality, and community connections. How can you create a more inclusive environment for your clients? If you're looking to expand your knowledge further, I highly recommend exploring the course on Gender and Sexual Identity Affirmative Approaches to Therapy, offered by Therapy Trainings. It's filled with valuable insights and practical tools that can enhance your therapeutic practice and help you provide the best support to your clients. Thank you for joining me in this enlightening discussion. Remember, the work we do as mental health professionals is essential, and by embracing affirmative approaches, we can create a more inclusive and supportive world for everyone. If you'd like to learn more about the ALA's course and other offerings, please visit therapytrainings.com. Together, let's continue to foster understanding and acceptance in our therapeutic journeys. Until next time,